Dr. Bob Adams, thanks for jumping on with us, man. For the second time, your time is valuable, but we appreciate you making us trying to do round 2 of this with us. One of the cool things that happened because we're doing this a second time is I learned a lot more about you and what you're involved in from our first podcast. And so I want to start maybe going a little bit. Last time we started talking about like the fact that you're a little bit of a Renaissance man, Navy SEAL, who went, what'd you go, 15, 16 years in the teams?
18 years in the Navy, 12 were in the teams. Now I'm counting my Naval Academy time because I wore a uniform for those 4 years for sure.
Fair enough. And I think a bunch of Academy guys would say the same thing.
Medical Corps.
That's right. And then went on to the Army, made it to Colonel, became the medical doctor for Delta Force, for the famed Tier 1 unit Delta Force, and now you're a doc in private practice. So I've just summarized what has a lot more story behind it, a lot more really cool components that we can dig into. But we ended last time we talked talking about what you're doing now with the VA and helping do some research and getting some focus on, correct me if I'm wrong, frontal lobe glioblastomas in special operations forces. Is that right?
Temporal lobe glioblastoma. And I got interested in it because I lost one of my bud's classmates to that later in his life, but long before he should have died. He was a captain in the Navy by the time they diagnosed him. And these tumors are universally fatal, and there's an extraordinarily inappropriate amount statistically in the Army and the Navy Special Operations Forces, specifically temporal lobe glioblastomas. And I have a theory that I'm getting ready to try to prove, and that is we stick our communication devices right here, which emit radiation, and in many times we put them under a wetsuit hood, under water, under pressure. And so, pushing it up against the bone. And I've noticed just on a first scan of names that I've found, the SDV team players keep popping up. So there could be, there could be a connection to that, whatever communication device they're using. So my plan, because I'm on the board of directors of something called the Institute of Medical Research here in the Durham Veterans Administration area, and they monitor, this organization exists to monitor government grants for medical research, primarily involving veterans or veterans issues. And I just called them up and said, hey, I want to prove that my theory is right or disprove it.
Sure.
And we've got some people spun up now, a neurosurgeon, a Veterans Administration psychiatrist that is good at getting the grants put together. And through my Delta Force contacts, we've connected at Fort Bragg, and we've got a lot of people spinning up to find initial funding to get this grant approved by the government, because it's a stepwise process, because the incident rate is definitely there.
Sure.
What I'm theorizing, based on the fact that all the studies on glioblastoma tumors have only been able to find a connection to radiation exposure in the grand population. So I'm going, well, wait a minute, we stick radiation devices right over the temporal lobe right by the ear, and we leave them there for long periods of time, and we use satellite links, and we talk underwater under pressure. It just makes common sense. We already know that cell phones by themselves emit a radiation amount that a lot of people think are dangerous. So now take it to a satellite communications and local communications going on the way, and over the horizon communications going another. There's a lot of radiation exposure there. And if I can find the people that have had this and connect it to a specific device, well, then we can then get somebody to come in, test that device, and find out whether it's safe. And if it's not, get it off the market.
Wow, interesting. Particularly, the piece about SDV guys, and for our listeners, I actually just interviewed another SEAL but a couple hours ago, and we were talking about our time in the SDVs, and it resonates with me to hear, you add the radiation piece, but then you add the underwater, the pressure, and I don't know anything about medical science on how pressure affects radiation transmittal, but I'll be curious to hear. I'm sure it takes a while to find a study like that to prove or disprove a theory, but I'll be curious to hear what comes out of that.
Yeah. Well, I'm going to participate in the study, and I've got people lined up to make it happen. I'll get back on with you once we've got it up and going, or if we get a real discovery. It's going to have take some time to do, but I will absolutely share it with you.
Why? I mean, obviously, coming from the special operations community, you spent time in both the Navy and the Army special operations community, so I'm sure it's near and dear to you, and it's reinforced by the fact that you lost an old teammate to that at an age far too young than he should go for that. But why?
The other, oh, by the way, is my Delta Force commander, who's my age, much too young to have to deal with brain tumors, is now coming up here to Duke University and doing battle with his temporal lobe glioblastoma. So it's two people very close to me. Wow. And I knocked on the Facebook 5326 website just recently and said, hey, who knows people with glioblastomas? And boom, I had like 12 names pop up. So the community is aware, and we're going to track it down.
Yeah, I had a teammate of mine back from 04, 05, 06 timeframe who I believe it was temporal lobe glioblastoma, a guy named Sean Flynn. But anyway, man, well that's awesome that you found a purpose and found something to give yourself meaning. We talk a lot about that on this podcast about the leadership piece and people wanting to have meaning and purpose in their work. You've done a lot of cool things that a lot of people would be envious of. Just your time in the SEAL teams, 18 years in the Navy, 12 of those in the SEAL teams, your time at Delta Force, and even in private practice, being a doctor. Is there any one of those that jumps out at you? That you say, you know what, this is where I really found my calling, or was it just you did your time and you moved on and you found a new purpose and kind of.
Well, that's a great question. You're probably remembering an answer from our last chat, because I had made commander in the Navy when I realized it's a young man's job, and I needed to look for something else that could be as much fun as being a SEAL platoon commander. And that's when I had to sit around and go, all right, where's my passion? Because being a young man on the SEAL team is about as much fun as anybody can imagine. And I thought about the only course at the Naval Academy that I got an A+ in, which was biology. And I went, well, who does biology? I just started brainstorming. I think doctors do biology. So I started looking around. I didn't have any doctors in my family to talk to about it. And, I had 1.5 children in my home when I walked in one day and said to my wife at 30 some years old, I think I want to go to medical school. And then she goes, well, that means we're going to be poor for another 7 years. But, why don't you do something that makes you happy? Because I had gotten my MBA and was working in DC doing Naval Sea Systems Command consulting in some special warfare operations areas, and didn't like it because I discovered early on that the business world is about money, and money comes without morals. And, I missed the sense of mission and camaraderie that you got in the SEAL teams. And I thought maybe taking care of people in the medical world would do it. And so when you asked what my passion was, the second book I wrote, which is Swords and Saints, A Doctor's Journey, this tells that same story in much more detail. And I wrote that just 2 years ago as I was winding down from my very busy private practice, because I left the Army in 2006, opened a private practice here in the Raleigh area and ran that for 14 years. And then, I'm just doing part-time stuff now, but I talk about in the book about my wartime experiences in Iraq with the 82nd Airborne Division, about residency training with the Army, didn't even know how to wear an Army uniform, and I was still using Navy terminology. It was a confusing time, and getting activated to parachute into Haiti 1 month after I finished my residency. All this stuff is in there, but the theme of it is I was having more fun than I dreamed of. It turned out to be an absolutely brilliant choice. I've often said, there's a God and he likes me because he leads me down the paths that I'm supposed to be going. And he took me to the medical school route, and it worked out real well.
The Swords and Saints book, you and I talked about that last time. There's a lot of cool stories in there about some of your trials and tribulations, and it's stories of success and compassion and vulnerability that you experienced in on multiple deployments and even back here stateside dealing with families. You experienced those things. What was the message you wanted to get across in the book? Is it just sharing the lessons and so people know what others are going through, or what was your sort of
there's
goal?
50 some chapters in the book, and each chapter is its own story, and many of them are individual patient experiences, some that make you cry, some that make you laugh, some make you go, oh, really? One of my favorite opening lines in a chapter about doing my first cesarean section baby delivery was, if this woman could hear my thoughts right now, she'd probably tell me to stop. But every doctor has to have a first time. And it was.
What do you mean by that?
Well, when you go to the doctor to have your hand sewn up, you might get a medical student, you might get a resident, you might get somebody who's never done it before. And I talk about being a medical student, being asked to sew up a farmer's hand when he'd cut it, and I couldn't tie the knot. And the farmer looks at me and goes, so, son, how many times you done this? Every doctor has to have a first time.
First time. I in the cesarean section story, I'm curious when you say if she could hear my thoughts, what is it? Is it like nerves? Is it imposter syndrome?
I mean, it's obviously I had done a number of C-sections before my first solo C-section. And even at this time, it's under supervision with the obstetrician sitting right next to me. In the Army and in the military, Army, Navy, Air Force, Marines, they all have family physicians delivering the bulk of their babies. Because one of the things that I lament about my experiences as a doctor was that I terribly miss the military environment where lawyers are not telling me how to practice medicine, where I can, deliver my own babies and do my own C-sections and, do your vasectomy. And, in the civilian world, they go, oh, you want to do a vasectomy? Add $6,000 to your malpractice costs. You want to deliver one baby? Add $90,000 annually to your malpractice costs. So I don't do it, not anymore. I really missed the fact that in the military world, I wrote a prescription, it got filled. And you didn't take the medicine. I called the first sergeant and told him to make you take it. So it was, you can't do that in the civilian world where 40% of prescriptions don't get filled because many times people can't afford to buy the medicine, including insulin for a diabetic. I found myself in the civilian world fighting fights for my patients that I would have never had to fight in the civilian world.
Let's pull on that thread a little bit. Let's dissect that. Just you went from medical practice in the military where you have a lot of the resources you need, and you have patients that are a little more compliant, and you have a system that's a little more geared towards helping you be effective. You go to the private sector. What's the biggest problem you saw? Private practice for 14 years in the private sector that you thought, somebody else does. And part two of that question is, does somebody else have it figured out, or is there other countries? You hear on social media like, oh, the Swedish system, they take care of their people, and then you see that the Norwegian or the Swedish tax base is whatever 60% of their income or something, right?
Right.
So the two-part question is, what's the biggest challenge you saw, and what's the solution?
So I have an answer to both of those questions, and I hope a CEO of a hospital somewhere will watch your podcast and go, wow, Bob, that's great. But the problem is that modern medicine focuses on the money and not on the patient. And what that does is it creates an organization that is shaped like this, with the CEO at the top and the doctor being compressed by all of these layers of bureaucracy above him that are all focused on monies, your bonuses, and are all based on productivity. How many patients can you see in an hour, and how quickly can you see them? And all these people stuff their needs and wants onto the doctor, who just wants to take care of his patient. And if you turn that organization upside down, and you make all of these players in the system focus on patient care, you would have a happy doctor and a happy patient, and you'd discover that you need so much fewer staff to make the doctor happy, because all he wants to do is be able to get the medicines, get the resources, get the tools, have the time to take care of his patient. And there is a new practice that I've been working with for the last almost year, called a direct primary care practice. And these practices are primary care, and they don't take insurance. You pay an $80 a month subscription fee for same day, next day access every time you ask, and you get what you need with 24-hour on-call services. And the system that we're living in now, people are being forced to buy these high deductible insurance plans. And just going to the doctor, you can't afford it. I've had patients tell me, I know you want to see me again in 3 months, doc, but I have a high deductible plan, and just walking in your door cost me $300. And I'm a salary doctor when I'm working for the big guys. I had no idea that kind of stuff was going on. Whereas what if for $80 a month you can get unlimited access, guaranteed access, same day, next day? It's becoming more and more popular. The doctors love it, the patients love it. And I had a multimillionaire as a patient recently, who I brought in as a new patient. And I asked him, I said, hey, you got all the money in the world, you can go anywhere you want. Why did you come to this, small practice for $80 a month? And he goes, I'll tell you why, doc. We've been talking for 1 hour, you and me, and you have never once touched a computer. You've looked at me the whole time, and I've never been to a doctor's office when they even look at me. I went, wow. And that's a sad, statement of the way medicine has come. Everything goes into electronic medical records by law, and we in the doctor world are having to fight it. So
what,
the message,
aren't EMRs, the electronic medical records? I mean, yes, sure, there could be improvements to it, but by and large across the system, isn't the electronic medical records effort really leading to improved medicine and longer term understanding of somebody's long-term medical health?
Yes and no. Obviously, you can use electronic medical records for data search and research. The individual doctor doesn't do that. So if
Right.
if you ask your doctor when you go see him next time, if he is benefiting from his electronic medical record, almost 100% will say, no, I am not. And is my care better because you have an electronic medical record? No, it's not. Certain exceptions. I really do love the fact that I can look up your medications and know when you took them and when you refilled them, and that sort of stuff comes in handy. But I can do that with any computer-based data search system. It's we don't get paid unless we check so many boxes to the insurance company for your care, and the insurance companies know everything we're doing when we do it. And I've had medications denied on a regular basis that I've had to fight the system for. Quick story on fighting the good fight and winning.
We like stories on this podcast.
I wrote the prescription. It's the only medicine that would help this lady, and it got denied by the insurance companies. It's expensive. So I appealed the decision to Medicare, and they said denied. So I said, okay, next step, I want a peer review where you got to put me on the phone with a doctor, and we're going to have a conversation. And doctor to doctor, you have to tell me why you're disapproving it when there's no other options. Did it? He denied it. So then I called him and I said, well,
he denied it based on what?
So money primarily.
Did he say that openly, or?
No, he can't say that out loud. He says,
right. That's where I'm going.
I'll review, your concerns and get back with you, because it's an insurance decision. And they said denied. So I called him up again. I said, what's left? Well, you've used all your appeals. I said, there's nothing else I can do. And they silence. And he goes, well, you could ask for a judicial review by a law judge. I'll bring it on. Really? I go, yeah. So 1 week later, my phone rings. Dr. Adams, this is Judge so-and-so. We're here for that judicial review you requested of Medicare. Medicare, you guys on the phone? Yes, sir, on the phone. I got one question for you. And this is you could tell this judge was not happy. Did you read the letters that Dr. Adams sent you? And they go, oh, well, sir, he sent us an awful lot of paperwork. That's not what I asked you. I asked you if you read it. And they go, well, wait a second. Well, let's just look here. No, don't you need to look? I'm faxing it to you right now. Read it. And there was this pause. And he goes, is there a reason that you can think of that this woman should be denied this medication? And they go, no, sir. Fine. She's
there's money.
Dr. Adams, thank you for your time. Click. And they did not deny me a lot of medications after I fought the good fight.
So what is the takeaway? If you're going to find a primary care physician, find a guy who spent 12 years in the SEAL teams and then a career at Delta Force to go to battle for you.
No, not at all. I know
you could be a consultant just on that alone.
I know a number of good doctors that are willing to fight the good fight, but it's interesting how many of them have military experience. And for the record, the military training program is head and shoulders above what the civilian world is, because it just doesn't have the restrictions. I scrubbed in on the orthopedic surgeries. I put knees in. I, help brain surgeons find brain tumors. Not, I'm just dabbing, but, I saw what happens. I delivered my own babies. I, was in the hospital in ICUs and CCUs. And when I opened my own practice, I hired a young lady, brilliant doctor, extremely intelligent, right out of her residency. And she would come to me with questions about patients and I'd answer them. And she'd go, how do you know that? I said, because I've seen it. I've been there. I was in the operating room. And she goes, wow, we never got a chance to do that. So it's, and she's still a brilliant doctor. And 10 years later, she's as good as I think I ever was, just because she's learned over time from her patients. But
do you think is there a little bit of a mindset that that maybe veterans and military folks bring that, and I don't know if that all veterans, but I'm going to deny you. And it's a little bit of like here, hold my beer while I go after this. Like, oh, you said I can't do something. All right, we'll see about that.
So almost every doctor I know of will fight for his patients.
It's awesome.
So it's not but maybe the ability to fight or to take it one step further is there with people in military training. But I just got off the phone this morning with a young Marine who wants to go into the medical world. And one of the things I warned him about was the difference between the military and the civilian worlds. You can't approach civilian business like you could approach military business, whether it's medicine or otherwise. And I'm sure you know that at Greencastle, you got to tiptoe up the chain of command. You've got to take care of your bosses. You really get in trouble by running to the CEO and asking for a decision, like we could do in the military. You don't do that in the outside. So it's an approach that you have to learn. If you were a military doctor, you've got to learn how to be a civilian. And I screwed up a number of times in civilian, interactions that I wish I hadn't. I wish somebody had told me can't do that. But but I want to tell you a war story real quick. So fast forward to 82nd Airborne Division in Iraq. I got there in the early part of the war, 2003, 2004, and was given an amazing task to come to Baghdad from where we had built our combat clinics and teach doctors in Iraq what had happened in the previous 25 years of medicine, because Saddam Hussein had shut down the country. There was no internet. There was no phone calls outside of the country. Doctors had to teach at the bedside, handwritten things, books were old. And you learned, you taught what you knew 25 years ago. And bingo, we opened the door and the eyeballs opened up and the doctors came running to find out what had changed. And I ran a 4-day conference there that I flew in 32 doctors from Great Britain and the United States across all specialties and said, here, your job is to tell the doctors in Iraq what's changed in the last 25 years. And
these are Iraqi doctors, correct?
These are Iraqi doctors.
Okay.
Yeah, we brought in 700 Iraqi doctors to Baghdad. and made 10,000 copies of the CD-ROMs to send out to all the other doctors in Iraq about these lectures of what's changed. But the reason I tell this story is I would talk to these doctors and tell me about your medical system, because they come to me and ask me funny questions like, how do you treat depression from a psychiatrist? And I go, well, have you ever heard of Prozac? I think so. And I said, and don't you get a lot of depression in your female patients since 100,000 soldiers were conscripted and killed in Saddam's wars? He goes, oh my God, yes. I said, what do you use? And he tells me that he uses this antipsychotic drug that's extremely powerful and rarely used today. And I go, does that work? He goes, no, but it does alleviate the symptoms somewhat. and then I tell him about Prozac. He goes, can I please get some for my wife? Well, yes, you can. Here you go. Gave him some. But then as I'm talking to these doctors, I'm finding that all of them went to medical school in English because the British owned Iraq back in the day in the 1920s, and medical school became an English thing, and it's free to everybody. You want to be a doctor, go be a doctor, and it's free. But when you get out, you do one internship year in the hospital, and then you're sent out into the outlying clinics for 13 years before you come back to finish your residency and learn a specialty. And I'm going, well, now during those 13 years, when you're out in the desert clinics, how much money are you getting paid? $100 a month. Can you live on that? No. We live with our parents. We live in the clinic. We get food. I asked them, I tell you this story because of this question. Why do you do that? Why do you become a doctor? And universally, across all of the doctors I spoke to, whether they were, in their internship year or specialists, they said, I did it because I wanted to help my country. I wanted to help my people. Wow. And that's what doctors did in the 18 and 1900s in the United States, is my point, because we got paid in chickens and, and pennies and whatever that was available. And you marched on and you went from community to community serving your people. And back when the smallpox vaccination came out, the doctors would carry smallpox scabs around in a matchbox, cut them into pieces, poke them on your arm, go to the next town, do the same thing, and then harvest the scabs from the places they've been. And wasn't the most sterile way to get things done, but it worked. And they didn't get paid much, and everybody did everything back in those days. So I was very much impressed by the doctors that were serving their people in the country. And they, just for the record, because a lot of people don't know this about America in Iraq, almost without exception, these doctors would come up to me and my other American doctors and hug them and cry on their shoulders and say, thank you for bringing us our freedoms to Iraq, which we are now enjoying. The internet came, we've learned that there's a world out there, and you brought it to us, and we're voting, and they showed me their purple thumbs, and thank you, America, for that. And a lot of these doctors I'm still in contact with, and they're still to this day very grateful for what we did. Despite the politics associated with it, we did free a country from a dictator, and we did save a lot of lives subsequent to that.
Do you think I assume you brought up the fact that that Iraqi doctors are saying overwhelmingly, like, we're not making money. We're going into this because we generally care about well-being for our fellow citizens, and that's why I went in to be a healer. Yeah. I assume you brought that up because is it fair to say that you don't believe that folks going to American medical universities are going in with the same idea?
No, they absolutely are going in, and they're maintaining that same reason. There's still high application in the United States, in all countries, to be doctors. And the primary overwhelming reason is they want to help people. They want to be of service to their patients. The point I made earlier is the system in the civilian world that they get hired into is not interested in that as much as they are the money side. And that creates a conflict of care versus, compassion versus, money.
Do you think that leads to an exodus from people who are just saying, you know what, F it. I'm tired of trying to deal with the institution, the healthcare system, and the competing priorities with the insurance system, and my own priorities, which are, trying to serve as a somebody who's trying to help improve the quality of life. Does that lead to an exodus?
Yeah, it does. And there's multiple articles in all the medical journals about our declining number of doctors. Burnout is a classic, story you see in the news, and doctors are leaving at younger ages and just looking for other ways to help other than, working for the money people. And I'm synthesizing it, but we're 50 or 60,000 family practice doctors short in the United States. Wow. To take care of the population we have, and some of that is because we're not graduating as many doctors as we could because they put limits on that, and the other part is people are leaving the practice early, and you're seeing now urgent care centers pop up all over the place, manned only by nurse practitioners or physician's assistants with no physician present. It's and they've got 2 years of training. A doctor's got 7, 8, 9, 10 years just to be able to get out there and be their supervisor. So it's creating an environment that is riskier than I would like it to be.
What's you teed it up at the beginning. You said there's a problem and there's also a solution. What and again, I've been a recipient of privatized healthcare for a long time. I know that if you talk to the people who work for the big pharma companies or the big healthcare companies, they say, yeah, we have our problems, but it's not like there's some evil, warlord sitting at the top, just swimming in his vat of money. We're all in it for the same reason. We also understand it's a business. It's a for-profit business. We also understand that the development of new drugs is not cheap. It takes a lot to get there. That insurance companies look, they say that, the actuarial science suggests that we're not just sitting there, paying shareholders, but there's science behind what we have to charge. So when you look at all of those things, is there a better balance that we can strike?
So pharmaceuticals is separate from the care organization I'm talking about.
Sure.
That's a completely different industry. It has nothing to do with what we're talking about. But I will mention this to your listening audience because some of them are going to go, no, that can't be true. The Congress of the United States exempted the medical insurance companies from the antitrust laws, the anti-monopoly laws, which gives them permission to price fix your care.
No, that can't be true.
Yes, it is. And here's what happens when a doctor goes into private practice, which happened to me. The insurance companies all walk in and go, oh, you were with the big hospital group, which is where we want you because it's cheaper to bill and collect through these big organizations that we've built. But now that you're a private practice doctor, we're going to cut your reimbursement rates of all of your patients by half. So I had Blue Cross Blue Shield, United Healthcare, come in and hand me a new contract when I became a private practice doctor for reasons we can go into later. And I went, well, wait a minute. These are the same patients that I was caring for that are paying you the same premiums they were paying you. Why are you cutting my reimbursements in half for an office visit? Well, because we can. We're a monopoly, they told me. And I wrote that letter to the editor about Blue Cross, rep who told me that. And I got a call from the president of Blue Cross Blue Shield North Carolina going, so Bob, I wish you wouldn't tell people that, Okay, but I wish you'd stop doing it. And the reason, by the way, is the government cannot pass a law that says doctors should not be in private practice. That would never happen. But if you give the payers the ability to cut payments to the private practice doctors to the point that they can't make a living, which is exactly what's going on, then they all choose to aggregate to the big entities that are shaped like this. And in my opinion, the government's intent, and there's things to back this up, is simply that we're moving towards a single payer system where Medicare for all is in our future, and we will become a socialized medical system, and all the doctors, are going to work for the system as employees. Not a bad thing, by the way, but it's working in Canada and England and Iraq and other places around the world, not well and not efficiently, because people from all those countries still come to the United States to get their care when they have to wait 9 months to get a gallbladder removed in Canada.
Yeah.
So but that's where we're headed. And all of these decisions make sense if you think about it from the government standpoint of wanting to fix our medical system by making the government in charge of it.
So let me go back to your model, then your system that you talked about being with for a little while. The $80 a month, no involvement from health insurance. Is that sustainable? Is it scalable?
It's very sustainable.
Doesn't that open up the ability, like you said, I can call you, I can see him within a day or two. Does that invite people to just start calling their doc once a month and be like, hey, I got the sniffles, I need to come and see you? And doesn't that eat up your time? You only have so many hours in a month.
So it's rare that a patient will do that. I've had one or two that were over users, but if you welcome them every time and you answer their questions every time, they stop doing that. Many people will abuse the medical system just to get the answer to the question that they're trying to get answered. And when a doctor only has 12 minutes in your office with you, and 10 of that spent typing on his computer, you keep coming back until you get the answer that you're trying to get. And there's a chapter in my book, once again, Swords and Saints, A Doctor's Journey, that is one of my favorite cancer chapters, called Oh, By the Way. And I tell my students and my residents that the most important words that ever come out of a doctor's visit are usually the last words as you're walking out the door, when the patient says, oh, by the way, did I tell you about this black spot on my shoulder? Or, am I supposed to be pooping blood? I mean, is that a bad thing? That happens all the time. And, somebody says, oh, by the way, I stop, I turn around, I put my computer down. I said, now, what are you really here for? And let me take the time to answer your question, so you don't have to come back 10 more times to get it. And it's a fascinating dynamic that I see repeated all the time.
Is this a business model we can expect to see a little more nationwide?
I think so, depending on how quickly we transition to the single payer system. I mean, Blue Cross will still be there, United Healthcare will be there, but they'll be, billing the government like they bill Medicare, which is the government, and our aging population, a large percentage of big organizations' money comes from the government now through Medicare payments and Medicaid payments. Yeah. So all we got to do is take that civilian paid version and throw it back into the government's money pile. So
there's sort of a recurring theme in the things you've talked about, which is that you're not afraid to take on a challenge, and when you see something wrong, you're going to call it out and go after it, which for me is a good opportunity to talk about your original book, talking about Hell Week, 6 Days of Impossible, right? Navy SEAL Hell Week.
A doctor looks back, because that was one of the key parts. I wanted to know why you made it through Hell Week, because you and I and the 11
I got carried through.
What?
I got carried through. By guys that were bigger and badder and better than I was.
Yeah, not a chance. Now, these 11 men out of the 70 that started in my class, and you and I, all have one thing in common, and that is we endured through one of the toughest military trainings in the world, if not the toughest. And what I did as a doctor is I went back to interview all my surviving classmates and go, what did we have in common? Because reunion after reunion, we'd get together and go, why us? We weren't the biggest, fastest, strongest. And yet we endured in a one sentence answer, the theme that I discovered in our 11. And I've asked Mike Thornton, the Medal of Honor winner, if he believes this could be the case, because he was our instructor and we've remained friends over the years. We discovered that every one of us, before we decided to go to SEAL training, had already been tested by life. And in many cases, beat up by life. We had one of my classmates who spent 44 years in uniform and went through training as an E5 and finished as a Navy 06 captain. He said, I was so poor growing up that poor had 4 O's in it. and the only meat I got was what I killed with my slingshot. I went, okay, you were tested early in your life. The people who fist fights with their dads and alcoholic parents. And one of my classmates was, an unwanted baby that was left on somebody's doorstep and was raised by 70-year-old couple. And, was on his way to jail after discovering hockey and fists. And, before he said, maybe I should try something different. And luckily bumped into a man who pointed him towards the SEAL teams. And he went on to go from an E2 to an O5 sniper in SEAL Team 6, bless his heart. And those kinds of stories are because of enduring.
There was nothing that, at least according to the ACEs survey, there was nothing that Buds was going to throw at you that life hadn't already fed you in large doses.
Yep. And we've always been confused in the people that have evaluated the winners and the failures and Hell Week, why the ultimate athletes don't do well and why the star quarterbacks don't make it. Well, because they got options on the outside and they've never really been beat up because they were good when they were born. We were not great when we were born. We became great through adversity. And that's what, makes the SEAL team so successful. You look to your right, you look to your left, you know that you've got people that have been tested by adversity that you can trust in any situation.
What stands out is I think about some of the most respected and the hardest charging guys in my Buds class, and they were not guys that were elite athletes. They were guys who just couldn't be broken. One of the guys, a buddy of mine, I'll keep his name out of here, just call him Don. In Buds, he earned a lot of extra attention. He did bring that on himself, but he was a guy whose mom had been in and out of jail. His dad had killed himself when he was just a kid, and Don had found his dad. So by the time he got to Buds, there was nothing that Buds was going to throw at him that life hadn't already handed him in just massive doses. If anything, he was getting 3 hots in a cot, and he was in a life that gave him meaning and purpose. But in terms of breaking him, there was nothing the instructors could do that doesn't mean he wasn't tested and pushed beyond his limit. But man, that was a guy, if I was ever getting my ass shot off in an alleyway in Baghdad, that's the guy I'd want to come get me, because there was no quit in him at all.
That's true of everybody. But I when I wrote this book 35 years after graduating Buds, I was reluctant to say out loud something I had never told people before. And that was when Hell Week is designed to get you to your point of no return and then get you to step over that point, get you to your mental and physical absolute limits, discover it, and then step beyond it. And I never got there. And when I told some of the people that I was interviewing in my class, I said, I'm really ashamed that I never got that exciting moment of discovery about here's my absolute physical and mental limit, because I could have kept going. 2 of my other classmates said, no, me too. I was really surprised. We expected it and it didn't happen. And then when I analyzed it, I said, I'll tell you why. Just like the man you were talking about, life had already taken him to somewhere. If the Navy SEALs ever tried to take him there, it would be illegal.
Interesting. There was not a seminal moment for me, and I think a lot of times you people expect that. Like, there was just an aha moment.
Right.
It wasn't an aha moment for me. It was at the conclusion of a day or the conclusion of a week where I went, oh my God, that was the worst thing I've ever experienced. I don't know how I made it through, but I did. And then, I'd call my mom on Saturday afternoon and be like, yeah, I made it through another week. I have no idea how. I just did. And I don't know why or how I didn't quit, because I sure felt like it. There were moments, but there wasn't a singular moment where I was like, I got this. I think every week I was like, oh man, what are they going to throw at us this week?
Now, all 3 of myself and the other 2 guys, we talked about this. When they said you're secured from Hell Week, it was like, wow, I did it. And this is exciting. And I really wanted to get to this point. And this is a great life achievement, but I could have gone further, and I'm not going to tell anybody that, because I've never been so tired in my entire life or in so much pain or as cold. But I could have done more. And all three of us said, yeah, me too. But aren't we glad they didn't try to take you one more minute or hour?
Right. And I think there's for people who listen and go, I don't know, Bob, John, are you guys full of shit? There is a thing, and I think it's fair to say when you're in Hell Week, like you are exhausted up until about Wednesday. And then because you've been awake Sunday, Monday, Tuesday, Wednesday, 4 days straight awake, no sleep, just constant moving. You're just getting beat. You're cold, you're wet, you're tired, you're hungry. Well, come Wednesday night into Thursday, you're really on autopilot. And I remember the instructors being like, do this, do that. And whatever they said, I did. There was no thought. There was no like, well, is this the best idea for me right now since I've been awake 5 days? It was like they told me to do it and I did it. And come Friday, you're right. I probably could have kept going, not because I was functioning on any kind of like, real thought process. There was no cognitive analysis going on. I was just go do this. I probably could have been awake another day if I had to, because I was if there was ever such thing as real zombies, it's a Bud's class who's in the 5th day of Hell Week.
All right, now you just opened the door to one other thing. Well, we've got time. I wanted to mention. A lot of people are aware that a Navy SEAL died during SEAL training just this last February. That made the news.
No, a Navy SEAL candidate.
Sorry, a Navy SEAL candidate. Exactly right. And his name was Kyle Mullen. You can look it up in the news because it's everywhere.
Yeah.
And the New York Times did an incredibly unfair article accusing him of using performance-enhancing drugs. Now, he had already completed Hell Week. He had already won the fight that he meant to fight, and he would have gone on most likely to be a very successful career SEAL. But he died of a pneumonia and almost killed another one of his classmates with the exact same streptococcus pneumonia. The two autopsies were done. There was no sign of performance-enhancing drugs in either of the men. And so, just for the record, we know for a fact that, yes, he died. Yes, Hell Week's hard, and it's a rare event because the medical monitoring system is so good. But, I had a little 6-minute spot on TMZ Live TV a couple of weeks ago. I think
we were going to go that. We weren't going to get off this podcast without talking about you being on TMZ.
Yeah, it was. They go out of the blue. They called me and goes, "We found your book. And we see you're a doctor. Do you have an opinion about the death of this guy?" And as I had been researching it already, and I said, you called the right guy, let's have a little chat. And when we were done, they went, oh, well, we were misled by the New York Times. I said, yes, you were. And
you're like, wait a minute, what?
Me. And I made the point, and I'm bragging here a little bit, that 21 years ago, we did have a death during Hell Week. And it was an officer who was using performance-enhancing drugs, ephedrine and creatine, both of which were banned that day by the admiral in charge, because he and I had that conversation when I got his autopsy report. I said, hey, I'm seeing this on Fort Bragg 4 or 5 times a year during the summertime. They're using these products causing hyperthermia, pulmonary edema, congestive heart failure. And he goes, oh my God, what do I do? I said, I don't know, Admiral, but if I were you, I'd ban all these substances. And he did the very next week. There hasn't been a death in, SEAL training in 21 years until this one, which had nothing to do with performance-enhancing drugs because it's been banned and it's monitored. And we do a very, very good job of taking care of our candidates in SEAL training.
Sure. And to be clear, I should qualify that that Kyle was a SEAL candidate. It doesn't take away from the fact that he was a sailor and a brother in the Navy with us. But people had said a Navy SEAL died, and there's a difference, as we know, between those who have completed training and earned their trident and those who haven't. And it's a small but subtle but important qualification. Hey, I know folks. We always ask where folks can find you. It is sealhellweek.com for the 6 Days of Hell book, right?
Yep. And I have an overall website because my third book just got published this year about the Civil War, 600 letters from my great-great-granddad home to his wife while a corporal in General Grant's headquarters. And if you go to swordsandseals.com. You can look at all 3 books, and you can order autographed copies from that. Swordsandseals.com.
The book is Swords and Saints, A Doctor's Journey. The website is swordsandseals.com. Your books are also on Amazon. Folks,
And audiobook.
Dr. Adams, Dr. Colonel Robert Adams. Hey, thanks so much for joining us, man. We appreciate it. Guys and people can find you. You're on LinkedIn under Robert Adams, right?
Yep, LinkedIn, and each book is on Facebook. Check me out. You won't have trouble finding me, Robert Adams.
What's your TikTok handle?
Oh, Buds81. It's at Buds81 for Twitter. And
I'm kidding. I'm assuming you're not on TikTok.
I'm not on TikTok.
If the kids want to Snapchat you, they have to first tell you what Snapchat is.
Correct. Absolutely.
All right,
I'm over the hill there.
Thanks again for joining us.
It was a delight. Thanks for bringing me back on again.